Bismillah ar-Rahman ar-Rahim. This is the second lecture of thyroiditis. The question now, what are the symptoms of thyroiditis? The symptoms of thyroiditis depend on the type of thyroiditis and its phase. Most types of thyroiditis cause thyrotoxicosis symptoms, followed by hypothyroid symptoms. Subacute thyroiditis and acute infectious thyroiditis usually also cause pain in the thyroid area. Some people with thyroiditis have an enlarged thyroid gland, this case called goiter. The toxic phase of thyroiditis is usually short, lasting 1 to 3 months. If the thyroid cells are damaged quickly and there is a leak of excess thyroid hormone, the patient may experience symptoms of hyperthyroidism. Symptoms of hyperthyroidism include fast heart rate, increased appetite, unexplained weight loss, anxiety and nervousness, irritability, trouble sleeping, increased sweating and sensitivity to heat, tremors. We are seeing in this slide many symptoms of hyperthyroidism, for example, tachycardia, bulging eyes, photophobia, sleep disorder, high blood pressure, tremors, thinning hair, heat intolerance, menstrual irregularity, enlarged thyroid gland, weight loss. The phase of hypothyroidism in cases of thyroiditis has many symptoms. Now, symptoms of hypothyroidism, the thyroid phase of thyroiditis can long lasting and may become permanent. If the thyroid cells are damaged and thyroid hormone levels fall, the patient may experience the symptoms of hypothyroidism. We are seeing here many symptoms of hypothyroidism. For example, weight gain, hair loss, dry skin, constipation, nausea, painful and prolonged menstruation, irritability, anxiety, depression, insomnia, increased blood pressure and cholesterol, chills, convulsions, increased fatigue. The symptoms of hypothyroidism include fatigue, unexplained weight gain, constipation, depression, dry skin, increased sensitivity to cold, muscle weakness, decreased ability to concentrate and focus. We are seeing here many symptoms of hypothyroidism. In hypothyroidism, the thyroid gland does not produce enough thyroid hormone, and the symptoms are loss of eyebrow hair, enlarged thyroid gland, slow heartbeat, poor appetite, infertility, irregular periods, carpal tunnel syndrome, weight gain, poor memory, intolerance to cold, feeling of tiredness, cold sensitivity and swelling of the limbs, constipation, dry and coarse skin, puffy face, thinning hair, and hair loss. Now, what causes the thyroiditis? Thyroiditis is caused by an attack on the thyroid gland, causing inflammation. The body of the patient responds to an injury and damage to the thyroid cells. It has several different causes depending on the type of thyroiditis. We are seeing in this slide plasma cells produce antibodies. Antibodies attack thyroid cells and making damage thyroid cells and leak hormones of the thyroid gland. The most common cause or attacker is an autoimmune disease, which is the result of the patient immune system accidentally attacking the patient body instead of protecting it. We are seeing here case of severe acute respiratory syndrome. Virus attack the immune system in the patient and perhaps causes case of thyroiditis, for example, Hashimoto's disease. It is unclear why the patient immune system does this. Antibodies that attack the thyroid cause most types of thyroiditis. This chart lists the causes for each type of thyroiditis. We are seeing here a classification of thyroiditis. There are 4 types of thyroiditis: acute thyroiditis, subacute thyroiditis, autoimmune thyroiditis, and Riedel's thyroiditis. Acute thyroiditis, there are subtypes of this case: infectious thyroiditis and non-infectious thyroiditis. We are seeing here in autoimmune thyroiditis, chronic autoimmune thyroiditis, and subtypes of this case: Hashimoto's thyroiditis, atrophic thyroiditis, focal thyroiditis, juvenile thyroiditis, and silent thyroiditis, postpartum thyroiditis. Now I will talk about diagnosis of thyroiditis. The healthcare provider will perform a physical exam, including assessing the thyroid gland, and ask the patient questions about his or her symptoms and medical history. If they suspect the patient may have thyroiditis after, they will likely order any combination of the following tests to help diagnose it: blood tests, levels of FT3, FT4, TSH, and ESR, erythrocyte sedimentation rate, and a C-reactive protein CRP, and complete blood count or CBC. And must the patient make thyroid antibody test, radioactive iodine uptake test, and ultrasound for the thyroid gland. We are seeing here normal thyroid under ultrasound, but we are seeing here case of Hashimoto's disease with ultrasound for the thyroid gland. Now I will talk about the treatment of thyroiditis. If the patient in thyrotoxic phase of thyroiditis, the provider may prescribe beta blockers to decrease palpitation or fast heart rate and tremors. As the symptoms improve, the provider will taper off the medication since the thyrotoxic phase is temporary. In the case of hypothyroidism from thyroiditis, the treatment in this case, if the patient have Hashimoto's thyroiditis, the provider will prescribe thyroid hormone replacement medication such as levothyroxine. The patient will likely have to take this medication for the rest of his life, since the hypothyroidism from Hashimoto's thyroiditis is usually permanent. If the patient have subacute thyroiditis or painless or silent thyroiditis or postpartum thyroiditis and have hypothyroid symptoms, his or her provider will prescribe thyroid hormone replacement medication as levothyroxine. The patient will likely have to take the medication for approximately 6 to 12 months and then taper off it to see if he have permanent hypothyroidism or not. If the hypothyroidism is mild and he have few, if any symptoms, then no medical may be necessary. Other treatment for thyroiditis, if the patient have acute infectious thyroiditis, the infection will need to be treated. This will likely involve antibiotics. If an abscess forms on the thyroid, his or her provider may need to drain the fluid and pass with fine needle aspiration. Other treatment for thyroiditis, drug-induced thyroiditis, or the case of thyroiditis from taking drugs, usually lasts as long as the patient are taking the medication causing it, like amiodarone, interferon, lithium, cytokine. His or her provider may switch the patient to a different but similar medication to treat the thyroiditis, or they may prescribe levothyroxine or thyroid hormone medication while the patient continue to take the medication causing thyroiditis. The pain caused by acute infectious thyroiditis and subacute thyroiditis usually can be managed with non-steroidal anti-inflammatory drugs such as aspirin or ibuprofen. In some cases, the pain can be severe and may require steroid therapy, like prednisone. Renal thyroiditis requires surgical treatment. The question now, can thyroiditis be prevented? Unfortunately, most cases of thyroiditis can't be prevented. If the patient have a condition that requires treatment using radioactive iodine or radiation therapy, talk to his or her provider about his risk of thyroiditis. The patient may be able to start with other treatments to avoid developing thyroiditis. If the patient take prescription drugs that can cause thyroiditis like amiodarone, interferon, lithium, cytokine, talk to his or her provider about his or her risk and if he or she can stop taking this medication. The question now, what is the prognosis or outlook for thyroiditis? The prognosis of thyroiditis is generally good. In the case of Hashimoto's thyroiditis, the resulting hypothyroidism is generally permanent, but it is treatable with lifelong thyroid hormone replacement therapy, for example, levothyroxine. People who develop subacute thyroiditis usually have symptoms for 1 to 3 months, but complete recovery of thyroid function can take up to 12 to 18 months. These people have about a 5% chance of developing permanent hypothyroidism. Full thyroid function recovery from postpartum thyroiditis, silent or painless thyroiditis, also takes about 12 to 18 months. People with these conditions have about a 20% chance of developing permanent hypothyroidism. In the end of this lecture, thank you for all.